Hello again guys, welcome back po muli sa ating channel. Another day of learning po. And before we continue with this video, kindly please subscribe, like and share po and comment na rin po sa ating videos so that we can upload more videos sa mga susunod na araw. For today's topic, it's very important po. Okay, so this is actually a topic under your community health nursing too, wherein we are going to identify the nature of the problem whenever we are doing the community health nursing process. Okay, so in identifying the priority problem in your community health nursing process, there are actually 5 criteria. And one of that criteria is the nature of the problem. And in the nature of the problem, it's very important for us to know which or what is the nature of the problem that we have identified in order for us to determine the priority score of that particular nature of the problem. Okay, so for today's discussion, okay, still this is a part of your community health nursing process, and still I am Sir Joel Cruz Pasqua, and am a registered nurse po, and we're going to continue discussing now topics regarding your community health nursing and of course nursing in general. Now let's talk about the fundamental practice of community health nursing. Okay, so we talk about the fundamentals of community health nursing. Okay, this is basically your community health nursing process. So from the word itself, health nursing process, this is using now, still using your ADPI, your assessment, diagnosis, your planning, implementation, and your evaluation. Okay, the part that we're going to discuss right now is part of the planning part of the community health nursing process, because part of the planning is to identify which problem should be given priority first in terms of providing solution together with the community. Okay, so when I talk about the nature of the problem in the community as part of the planning under your community health nursing process, there are three type, okay, or nature of nursing problems in the community health nursing process. Number one is your health status problem. Okay, another one is your health resources problems, and another one is your health related problems. We are going to discuss each and every one, each of these nursing problems, and we will try to relate this to the current situation of the Philippines right now, which is the current COVID-19 pandemic. Okay, so let us start first with health status problem. So let's talk about health status problem. According to our book, okay, health status problem is described in terms of an increase or decrease, okay, in any vital events. When I talk about vital events, guys, these are any uh, changes, okay, in the status of the community, okay, which includes now your morbidity, referring now to the disease rate, okay, may disease rate, okay, to a particular disease or to the to a collective of diseases, okay. Mortality rate is basically the death, okay, so death regardless of the status or regardless of the cause, okay. So meron din kasi tinatawag na specific cause, specific death cause rate na tinatawag. Then you also have your fertility rate, referring now to or related now to your birth rate. And of course, the reduce or reduction in the capability of the community to maintain a level of wellness. So basically, health status problems describe the community's overall health status. Marami bang nagkakasakit? Marami bang namamatay? Marami bang nabubuntis or nagkakaanak? Okay? Or nabubuntis na wala sa oras? Or anything that is considered as a vital event. Pag sinabi nating vital events, guys, these are any situation na ginagawa ng census specifically sa Pilipinas by the Philippine Statistics Authority. Okay? So, to describe this more, we are going to provide examples. So what are the examples of these health status problems? Okay, so health status problem number one, okay, an example is your increased death rate and cases of COVID-19. Okay, so with the current situation that we have right now, which is your COVID-19 pandemic, okay, marami pong natatamaan ng sakit. At the same time, marami din po namamatay because of COVID-19. And since this is a community-wide problem or a community-wide concern, okay, this is an example of a health status problem. Okay, kasi it shows it already shows yung susceptibility of the community. Okay, so when you say susceptibility, the ability of the I mean the situation or the status of the community wherein a possible epidemic or pandemic would occur because there are less protected people or humans within that community. For example nga ngayon, bago yung COVID-19 na virus, kaya hindi pa sa atin lahat is exposed. Therefore, yung ating immune system is hindi pa familiar. Okay, causing now this pandemic or the epidemic that's occurring right now here in the Philippines and also abroad. Okay, so an increased death in cases of COVID-19, so yung pagkakasakit. So increased death or increased cases of dengue fever, increased cases of cancer, increased cases of diabetes mellitus, or any increase in the numbers of people who are affected with a particular disease, okay, or particular condition. So that's an example of health status problem. Another one is increased cases of teenage pregnancy. Okay, this determine now yung status na since pregnancy, they are not yet expected to get pregnant. So yung pag-increase ng cases natin sa mga teenage would mean that yung ating cases na magkaroon ng more complicated pregnancies kasi nga pag less than 18 ka is they are considered complicated pregnancies is mas tataas. And of course, kapag complicated pregnancies po yan, the higher the risk of mortality among mothers or women who got pregnant. Okay. Another one is increased HIV cases. So this is still an example of a disease that is affecting now the community as a whole kasi marami na pong naapektuhan. Okay? So those are examples of your health status problem. Again, health status problem is basically an increase or decrease to any vital event such as morbidity or mortality in with regards or in relation to a particular condition or a disease. Okay? So like for example nga, the increase in COVID-19 numbers or infection is an example of your health status problem. Another one, another nature of the problem in the community health nursing process as one of the criteria is your health resources problem. Health resources problem describes the lack of or absence of manpower, money, materials, or institutions necessary to solve a health problems. So with the current situation that we have right now, COVID-19, okay, marami tayong health resources problems here in the Philippines. Okay, the following examples are lack of health manpower. Kulang tayo ng nurses, kulang tayo ng doctors, kulang tayo ng medtechs, kulang tayo ng mga respiratory therapies. Okay, we are lacking of manpower na tatrabaho doon sa ating mga cases na meron ngayon. I have watched a news the other day po ata yun wherein the Public Health Hospital Association is trying to increase their bed capacity. However, hindi po nagiging possible kasi nga is kokonti naman po ang manpower. Kahit gusto nila magdagdag ng bed, kung kulang ang nurses and doctors na tatao dun sa ward, is hindi rin siya magiging effective. Okay? There are a lot of reasons kung bakit kulang ang manpower sa Philippines. Of course, number one, kulang yung plantilla position. When they hire contractual, walang benefits. Okay? And at the same time, yung mga benefits kung meron man is delayed na ibibigay. So I know that you know the facts regarding the reasons bakit konti ang ating manpower. And of course, in terms of salary, napaka-laki po talaga ng difference ng salary ng mga healthcare workers sa Pilipinas compare abroad. That's why a lot of our healthcare professionals choose to go abroad and look for a better opportunity instead of staying here in the Philippines. Kasi nga, because of that opportunity na hindi na ibibigay sa ating mga healthcare worker. For nurses alone, okay, since 2002, according to the nursing law, which is Republic Act 9173, dapat po naka-salary grade 15 na ang mga nurses entry position. Okay, ibig sabihin, pag nurse 1 ka, salary grade 15, you should have earned about 31 to 33,000 a month plus benefits. However, okay, since nung naipasa yun, hindi po na-implement. Okay, ngayon po ata ini-implement pero hindi pa siya in full implementation kasi hindi ata nag-adjust yung mga sahod naman ng mga higher position na nurses. Okay, so yun, marami pa tayong questions. And those are some of the reasons why we have lack of health manpower in the Philippines. And by the way, just for the record, Philippines is actually if not the number one, is if not number one, we are actually one of the country na nagpo-produce ng most nurses and nagkakaroon ng migrant nurses abroad. Okay, another one, lack of medical materials and supplies. So, ito yun, lack of medical supplies. So, before, during the start of pandemic, nagkulang tayo ng mask, nagkulang tayo ng mga face shields, and of course, the medications is not yet available, though may remdesivir na, pero sobrang mahal. And of course, kulang tayo ng mga oxygen, okay? If you can see in the Facebook, social media, and even in the in the news, okay? May mga nagkukulang na hospital, okay, beds. Okay, yung iba nakatira nandun na sa tent, nandun na sa labas ng hospital, yung iba nasa ambulansya, nasa sasakyan mismo. Okay, those are examples of lack of medical materials and supplies as an example of health resources problem. Lack of healthcare facilities. Alam natin yan. Kulang na kulang tayo sa hospital dito sa Pilipinas. Okay, a lot of ICU, okay, is already filled with even non-COVID patient. Okay, punong-puno na po ang mga hospital na. So, na-overwhelm na po ang ating healthcare system. And that is an example of your health resource problem. Okay, and the last one is your health-related problems. So, health-related problems are described in terms of social, economic, environmental, and political factors. So, ito yung mga problema that can directly or indirectly affect yung healthcare system natin o yung health situation natin sa bansa. Okay. Alam natin, napapanood natin doon sa TV. For example, okay, political wars between two or more opposing parties. Dilawan versus DDS. Okay, yung mga ganung bagay. Okay, imbis na tinutulungan ng ating mga frontliner, imbis na nagbibigay tayo ng mga suporta, ang ginagawa ng ating mga politicians is nag-aaway-away ng kung ano-anong dahilan, causing now delays in projects, delays in procurement, delays in everything that is necessary to respond to this ongoing pandemic, which is very sad kasi nagiging priority nila yung image nila as politicians compare yung situation na nangyayari sa ating healthcare system. Another one is increased air, water pollution, and other sanitation problems. This is a very rampant problem sa Pilipinas alone. Okay? In Manila alone, siguro lahat ata ng river system sa Manila or in National Capital Region is already polluted. Okay? They are doing things para i-rehabilitate daw ang mga ito, but so far is wala pa sila sa punto na talagang ibalik yung talagang situation na healthy ang ating mga tubig, okay, and other and other body of water sa bansa. Okay, that's why though there are already things na ginawa para isagawa nito, like what happened in Boracay, what happened in the Pasig River, in the Manila Bay, okay, but still the problem lies with the Filipinos siguro kasi nga kahit siguro linis ng linis, kung tapon pa rin ng tapon, okay, toxic chemicals is still being dumped in our water system, still this problem will not be solved, and that's part of the health related problems because it will cause harm later on sa health ng mga tao. Another one is increased social hesitancy to vaccines. For example, may bakuna na, andyan na yung bakuna, kaso nga lang, namimili ng brand. Okay, what else? Ayaw magpabakuna kasi daw babawasan daw ang tao sa mundo. May mga ganong paniniwala. Ayaw magpabakuna kasi kapag nagpabakuna ka daw is lalagyan na ng microchip ang iyong katawan para daw ma-detect ka kung saan. Okay, planado yan ng mga CIA. Okay, in an anti-vaxxer groups in social media, sabi nila wag ka daw magpabakuna kasi nga it will cause autism. Okay, those are some of the factors that can affect yung ability of the person to have themselves vaccinated, which will save lives, not only theirs but also the lives of others. Okay, and the next one is your poor economic stability. Okay, especially for third world countries. Take note, a good healthcare system requires good funding. Yun po ang ibig sabihin nun. And of course, reluctant to community positive changes. Okay, kahit gusto ng ating gobyerno, kahit siguro gusto ng isang institution na baguhin tayo for the good or for the better, kung tayo i-reluctant at ayaw natin yung pagbabago, still we're not going to achieve that. So that would be all, and thank you. Please click like and share po.